All right, Will. Thanks for taking the time to come in. I'm super excited to talk to you today about everything we're going to get
All the
into.
stuff.
Yeah. Let's just get right into it and start with tell me where you grew up and, you know, how you got into this zone at like your early years of growing up, water stuff, getting into lifeguarding, that kind of thing, whatever you want to share.
All right. Yeah, so I'm Will. Grew up in Huntington Beach, pretty close to the beach. Water was a huge part of my life growing up, and that was, you know, in large part because of my family. Was really lucky to learn to swim really young by Gretchen in LaSalle, who some people will know. She's kind of an epic swim teacher who just threw kids into pools and made us learn. But
Did your parents put you into swimming? When did you start? Or
yeah,
did you...
so I would have been in the water a lot as a little kid, and then definitely would have been in swim lessons, you know, around 3, 4, 5. I don't know.
Cool.
When you do that. But yeah, so I have always loved the water. Spent a lot of time, you know, sailing at the beach, swimming. Water polo became a big part of my life in kind of the middle school years, and my path into lifeguarding actually was nothing profound. It was, hey, there's lifeguard tryouts on Saturday. Everybody on the water polo team should go. And I went, okay. And so I went to lifeguard tryouts and did the swim. Barely made the swim. That was 2007. And I made it to an interview, and that was good. You know, you're 16 years old, fumbling. I think my resume. And I was put onto an alternate list to become a lifeguard. So I didn't even make it into the class.
You and me both.
Oh, really?
Yeah.
Oh, yeah. Okay. So that was, you know, so yeah. So I remember going on the first day of training, and it was like if somebody didn't show up, or somebody showed up and their hair wasn't cut, or somebody showed up and they, you know, I don't know, didn't shave or something that morning, and they got booted out before class even began, then you could get in. So lucky for me, you know, that happened to somebody else, and I was in, and that was kind of the intro into my sort of lifeguard years.
Nice. And that was at age 16.
Yeah, that's right. So I was a sophomore in high school, playing on the Huntington water polo team, and then went through training with state parks, Huntington State Beach, and then worked several summers on the beach, and we can get into kind of the rest of lifeguarding as we go.
Sure. So swim lessons led to water polo, so kind of a track face towards lifeguarding, but accidental.
Yeah, I mean, it was never, you know, because like I talk to people now who say, oh, my older brother was a lifeguard, my uncle was a lifeguard, you know, my mom was a lifeguard, whatever it is, and it was always part of their path. That was not me. I didn't know any lifeguards. You know, I knew one lifeguard, right? A family friend. But it was never something I really wanted to chase, never something I really wanted to do. And then just kind of happened, and it became a huge part of my life during those years. It still is, and is like it started the trajectory of an entirely different professional career as well.
Yeah, absolutely. And just one more clarifier on, was your family like a beach family? Like, hey, every weekend we're going to the beach, you're boogie boarding, that kind of stuff. What was your early relationship to the ocean or the beach?
Yeah, so not really, right? You know, my Aunt Holly, my Uncle Ray had a pool, so we were in the water, in the pool a lot. We always went to the beach, but I didn't grow up surfing every Saturday morning. I didn't grow up, you know, living at a particular local spot. My relationship with the ocean, you know, as a kid actually was really defined by traveling with my mom in a motorhome. And so my mom was a school teacher. She taught special education at Edison High School, which meant that she got the summers off. And so, you know, come June 22nd, her and I would get in the motorhome and we would drive for 8 weeks. And so we did, as a young person, as a kid, I was really lucky to be able to see, you know, huge parts of North America, US and Canada. And a big part of that would have been the coast. And so, you know, as a 6th grader and a 7th grader, I was, you know, boogie boarding on beaches, like, you know, up and down the coast, and got to see beaches in Oregon and beaches in Washington. And it was awesome.
Nice. Is there any specific beach that you remember at that time that sticks out, or specific like event or thing that was like, oh man, I just got beat up by a wave here, or wow, this is incredible, I've never seen anything that sticks out during that time?
Oh, I remember one spring break we were up. You would have been Carpinteria, or one of the state campgrounds, kind of up in that Santa Barbara area. I couldn't tell you which one. And I remember being out in the water body surfing or something by myself. And compared to Huntington, where there's always somebody somewhere, right? Like I remember that moment of looking around going, I'm alone out here. This is pretty awesome. And then just got thrashed by a wave and thought to myself, like, yeah, I should be careful maybe. Like my mom's not going to come rescue me. My mom's not going to come help. She's sitting on the beach reading her book.
But it wasn't like a scary situation. It was just like a first time you had that, like.
Yeah, I think it probably was the first time where I went, oh, like
dang. An awareness.
Yeah,
let's call it.
An awareness. And I think, the second big awareness moment for me was, and we'll fast forward a little bit here. I got really into body surfing when I was lifeguarding, and that has continued to be a really important part of my life. And I remember the first summer after my 26th birthday, after I was no longer on my mom's health insurance. And I remember taking off on a big, it would have been an 8-10 foot, kind of summer swell at Huntington, South End. And I remember taking off on a wave and just getting slammed and then coming up and going, oh crap, I'm on the hook for this. Mom, I don't have mom's health insurance anymore. So I think that was my second kind of big, oh crap, aha awareness moment in the ocean.
Absolutely. Talk to me about, so you lifeguarded, at which point you went did you go directly to college after high school?
Yeah, so I actually had a really interesting opportunity when I was in high school. I was very fortunate to have the support of my single mother to go live abroad in Quito, Ecuador for my junior year of high school. So on paper, if you were looking at like Will Koon's high school transcript, I dropped out of high school. Right, for junior year, and I went and lived in Ecuador with a high school kind of study abroad program. And then I came back and re-enrolled and like barely finished senior year, right? And so, but as part of that, I learned Spanish, got to see the world, did a ton of traveling kind of in that Ecuador, northern Peru, Colombia area. And so at that point, Latin American travel became a really big and important part of my life. And after high school, went to university and I studied sociology. It was interesting, liked it, at Point Loma Nazarene in San Diego. So just far enough away from the family where no one was going to drop in and bring me lunch, but I could come home on the weekend if something, if I needed to, which was great. And San Diego was amazing. So I was studying sociology, and I was able to test out of a load of Spanish classes. And they came to me and said, hey, if you take like these 4 or 5 classes, we'll give you a double major. But part of that was that you had to study abroad, which threw a huge wrench in my lifeguarding plans because so many of the study abroad programs happened over the summer, or they you'd leave in August. And so anyway, so I found a program that was that lined up with the dates, and that was in the Dominican Republic. And so I was down in the Dominican Republic, doing my 4 months study abroad. It was great. And I was taking a community health class, which was actually my first intro to public health. And we'll kind of get there in a minute.
In South America.
And that was in the DR. And so I was in this class, and the professor knew that I was kind of a lifeguard, beach sort of rescue person. And Hurricane Irene kind of came through the Caribbean. And so she said, hey, we've got this hurricane that's coming next week. Would you be willing to help out? And I said, yeah, of course, right? And so they came, and I gave them my phone number, and they, so I got a text and said, oh, please, come here, be at this place at this time. It's before kind of the big brunt of the storm hit the island. And I thought that I was going to go and, move sandbags and, pick things up and put things down, right? And so I get there, and it's an amazing group of volunteers, and they all looked and they said, "Oh, the water rescue expert is here." And I went, "Whoa! This is not my area of expertise." So anyway, we got I corrected kind of them about what my real skill set was: not urban rescue, not flood, not swift water, not hurricane anything right up from Southern California.
But it makes sense, the understanding of what they would have thought. Or
Yeah,
maybe
sure. And lost in translation, of course.
Yeah.
But after that, there were some questions about, hey, beach lifeguarding in this part of the country hasn't really developed a lot. Do you think you could potentially put together a lifeguard course? And so I called a bunch of state lifeguards, and there were some Huntington City lifeguards at the time who had done some work in Nicaragua. And so, we came down and ran this course. And then for the next several years, I volunteered with an organization that was started here in Huntington Beach. And we taught lifeguarding all over Latin America, expanded out to other places. Drasco, I think you went on a trip.
Mm-hmm.
When was that?
A couple trips. I forget. Early in my lifeguarding career, would have been early 2010s.
Right.
Teens.
So you got to experience what it's like to go and meet lifeguards
Absolutely.
from all over the world, and so that was really meaningful to me. And so I did that for several years, and I was living the dream, right? Like lifeguarding for 4 or 5 months in the summer, and then living out of a backpack, traveling, lifeguarding in Chile and Peru and Nicaragua and Costa Rica and all these great places.
That's super cool.
Through that process, I started to understand that the work that we were doing needed a bit of structure and framework, and I needed to ground what we were doing, and I needed to upskill. Is kind of what I realized, is that I don't really know what I'm doing here, and if we want to maximize our impact, I should probably get some training.
Impact in relation to what? What impact?
I think impact in relation to are we being sustainable? Are we doing everything that we can to maximize the impact of a lifeguard training program in Baja or in Nicaragua or wherever we were? And so I started to ask some of these questions, right? And landed on the unfortunate reality for me that I was like, I think I need to go back to university and go back and get a master's degree, which was tough because I like I said, barely made it through high school, failed algebra 2, barely made it through university math, right? And so anyway, started to pursue what it would look like to get a master's degree in this kind of lifeguard / global health / drowning prevention. What does that all look like in an academic sense, in a research sense? And fast forward a little bit, I went up and did my master's in public health at the University of Washington in Seattle, which was amazing. Got a really incredible education there. Fell in love with statistics, which is fascinating for somebody who could barely get through high school math. And throughout that whole process, I started reflecting again on my years lifeguarding. And I started thinking about, a lot of what we do as lifeguards and a lot of what we know as lifeguards is, you and I have had this conversation a bit about lifeguard folklore, mm-hmm. right? And there's definite truth and wisdom and experience in that. But ocean lifeguarding is an under-scienced field.
Absolutely. Talk to me before we get into it.
Yeah.
That also led during that time when you were working on that to local projects here, some initial work with the lifeguards, right? Before we get into the dissertation or thesis, there's a couple initial Project Wipeout. Was that same time?
Yeah.
You're doing stuff locally here in Newport, Huntington area?
So I went up to Washington, and then came back to Southern California, and my wife at that time was working on her master's degree at San Diego State, and so we moved back to San Diego, and at that time had a really incredible opportunity to take all this public health research data kind of stuff that I was learning, and my lifeguard background, and this was the first time I was able to blend those together, was actually through a long-running program run out of Hoag Hospital in Newport Beach called Project Wipeout. And Project Wipeout started 45 years ago now, as a spinal cord injury prevention education program that was both aimed at the public, but also very much helping educate lifeguards about what can and should we do in these critical moments after a spinal cord injury happens on the beach. And so, so I got to learn, I got to use all my lifeguard experience and knowledge and help translate that for a lot of the people at the hospital. And then at the same time, I got to speak my public health speak in the hospital and help translate some of that back to the lifeguards. And so, yeah, so I was working on Project Wipeout for a little while. Was able to actually work with Scripps Hospital in San Diego as well to get a similar program up and off the ground. And that's still going, which is really good.
What's the name of that one?
That's called the Scripps Lifeguard Advisory Committee, right? And it's a very similar program run out of the trauma center. Basically tries to get all the lifeguards together, and it's equal parts public education for the public, right? But also trying to upskill some of the lifeguard agencies and get them on the same page about some of this stuff.
And I think that's a super important, and what's bringing us here, right? When I hear you say that, translating between hospital staff, doctors, people that are doing statistics and science related, let's call it in quotations, things versus the lifeguard at the beach and how they're pulling someone out of the water and how they need to understand what the lifeguard is thinking in that moment regarding that injury, regarding the prevention of the injury, regarding the treatment of that injury. And then vice versa, if the lifeguard on scene doesn't speak the language of translating the data and all this stuff, they might not be in tune to that. So that's, I think, a super critical role, which you're identifying here.
But we shouldn't expect like every lifeguard to
not at all
know math statistics. Like we shouldn't expect the public health nurse at the county to fully understand what it's like to pull somebody
but
out
we
of the
do
ocean.
Need someone
to bridge that gap
who has both sides to bridge the gap. I think that's super critical.
Yeah, absolutely. And so there are these bridge builders in our world. Like you're a bridge builder, Drasco. Like you're an artist, right? Like you're a storyteller, you're a photographer. Like you have this skill set that we don't require of lifeguards, but we need somebody to be able to tell these stories.
Absolutely.
Right.
So let's get into it then, unless you have anything else that I'm missing on that trajectory of before is there another college or or committee or something?
But like
that kind of leads you to where we can start talking about the thesis and the dissertation.
So the intro to the thesis and the dissertation actually goes back about 10 years. I was at my first World Conference on Drowning Prevention in Germany. This is 2013. And I met this guy, Canadian guy, professor, lives in Sydney. His name's Rob Brander. And he comes up to me and I go, oh my God, this is Rob Brander. This is like one of the world's leading rip current scientists, right? And like, I had read all of his papers and come to find out he's really cool. And like, he buys me a beer, like we're having a good time. And then the first time he says, hey, you should think about doing a PhD. And I said, no way in hell. I barely just got out of undergrad. I'm done, right? And then so I see him like a couple more times at these conferences, and every time that I see him at a conference, he says, "Hey, you should come do a PhD in Australia. We'd have so much fun." And I said, "No." So anyway, the intro to this was, I had known my supervisor Rob for several years, and he basically said, "Yeah, if you want to do it, now's the time." And the stars kind of aligned. So in 2020, January of 2020, my wife and I moved to Sydney, Australia for me to pursue a PhD focused on beach safety, coastal drowning, and that was with Rob. So that's kind of the
when did COVID hit again?
Yeah, right. So
what did he say about the time was right there?
Yeah. So actually, it was a wild time.
Yeah.
So we moved in January of 2020, landed in Sydney, and had 2.5 glorious months of Sydney summer. Right, we just came from summer, and then COVID hit, and borders were closed. State borders were closed. Right, like we don't want to relive that, but so basically we went and we were locked in for almost 2 years.
Maybe someone at the World Health Organization is like, we need to stop Will from traveling so he can finish this PhD.
Yeah.
We're going to close down all the borders so you don't leave again.
I mean, it's wild, right? Like, so Noelle, my wife Noelle and I travel has always been a big part of our life. And, for the first several years of our marriage and our relationship, we were like high-fiving each other in the airport. Mm-hmm. She was always traveling. I was always traveling. And so this was like the first time that we had actually spent, months together without leaving, and we figured out that we actually did like each other quite a bit.
Yeah.
So that was good. Right?
Cool. Well, let's get into this. So for people that are listening, and maybe if we didn't say it fully right now, basically you did what you were telling me in Australia, they refer to it as a thesis. In the US, it would be referred to as a dissertation, which solidifies a PhD.
Correct.
Right? And I had to do it at least once, but then I can call you Dr. Koon.
Okay.
Right?
All right. Now you're done.
Okay. That's
Don't
just
do it
one.
again.
But basically, you did a PhD, and do you want to tell us just the big picture, the name of it, and the general goal of what this was?
Sure. So the name of it and the goal are the same. It's called Expanding the Evidence Base for the Prevention of Coastal Drowning. So it is a collection of studies that are quite different in nature, actually, but they all are moving in the same direction of trying to expand the evidence and the science in the field of coastal drowning prevention. And so if we go back just a couple of minutes to when we were talking about lifeguarding, the true motivation for a lot of this was that question of, is what we're doing based in science? Is what we're doing based in evidence? And in our lifeguard world, a lot of the answer is no, right? Which is okay.
And we'll get into that too, right?
Right. Yeah. But a big part of this was setting aside some time, some dedicated time to be able to think through some of these things and advance different pieces of that puzzle.
Absolutely. So I want to set the stage for what is drowning, because through lifeguarding, even through definitely the public or in general, even in certain medical trainings and stuff that I'm still doing through working as a paramedic, through other certifications, through just seeing things online, the definition of drowning is different a lot of the times. So can you define for me what the latest and greatest definition and what it means, and explain that a little bit so we can set the standard for that?
Sure. So drowning is defined as the process of experiencing respiratory impairment from submersion or immersion in a liquid. That definition was a consensus-built definition where a group of experts got together in 2002. And they came out of this conference with that definition, which was very quickly adopted by the World Health Organization and lots of other groups. Prior to 2002, there were over 30 different published definitions for drowning, right? So if you read, in the medical literature, basically there was no consistency. So this, that 2002 point is really a marking, it's a bookmark in drowning and drowning prevention science and drowning, research, because for the first time it got everybody onto the same page. And there's two pretty important parts of that definition. The first part is that it defines drowning as a process, right? And a process has a start and a process has an end. Most people, or a lot of people, would think if I said, hey, what's drowning? They would say it's when someone dies in the water, all right? So drowning is a process, it has a start and it has an end. That end point results, there's three different types of outcomes from that end point. You can drown and die, that's a fatal drowning. You can drown and live, that's a non-fatal drowning. And then in a non-fatal drowning, you can either have no lasting consequence, no morbidity, or you can have a non-fatal drowning that has some sort of neurological deficit, or further disability that happens after that. So drowning is a process, and it ends in fatal death, non-fatal with morbidity, or non-fatal without morbidity.
Yeah, and I think that's super important to define and make clear, because like you said, most people just go, oh, he drowned, he or she drowned in a pool in the ocean. That's it. That's all it is. And it's so much more complex. And as we get into it, we'll figure out, but I really wanted to get it from your brain out so people can clarify that. Even the example I've used is technically what used to be called, and let's touch on that too, some people have heard near drowning or parking lot drowning.
Wet drowning, dry drowning, secondary drowning.
All of those definitions. And what that's referring to is I go in whatever body of water I'm submersed or immersed in it, right? I get a little bit of water. Maybe I aspirate some, right? Versus swallow is a different, that goes in the stomach, aspirating goes into your lungs. So if I have fluid built up in my lungs, there's stuff that happens after that without getting into the pathophysiology of it, where I can actually still have effects of that process, correct?
Right. And that would be a non-fatal.
Exactly. And that's still now, if I go to the hospital, should be defined as I technically still drowned.
That's right.
Which I think a lot of people are going to go, no, I didn't drown. I just swallowed a bunch of water.
Right.
No. Today's definition means if you go out there and you went through that process, there's now a level of you might need to get your lungs looked at, or you might have some lasting effect from that. You have drowned without being fatal, but with some level of morbidity, whether lasting or non-lasting, right? So I think that's super important to define and realize for people listening that is the way we need to look at drowning now in order to bring all of these concepts together.
Absolutely. And it's important for lifeguards and paramedics and practitioners to understand that, but it's also important, it helps frame the problem, right? We know in California, for example, there's about 3 non-fatal incidents for every fatal incident. But that number jumps to like 12 non-fatal incidents for every incident when you're looking at little kids. And so, in a policy sense or in an advocacy sense, having a bigger number actually can help move a conversation along. And those non-fatal incidents are still traumatic. They still affect rescuers and hospitals. They cost a lot of money. Right? Whether somebody goes and spends any time in an emergency department, or they go to an intensive care situation, or they require full-time care, right? So the burden of this issue is not just people who die. And I think it's really important that we consider the non-fatal piece of this. And, the next phase of this research is actually exploring a little bit further down the timeline, which is the psychological impacts of people who didn't actually drown, but had really close calls, right? So, Drasko, you and I have both made really hairy rescues. And I have, never really considered the impact of that experience on somebody. Because I would, swim out, it's crazy, everybody's fine, we got our tube, you get them back to the beach, they're still freaking out. You go, you good? Everybody's fine? Okay, and you run back to the tower.
Or the next rescue.
Or the next rescue, exactly.
Whatever, right?
Yeah, you run to the next rescue. And that event, in my mind at least, had always, I had never really considered what happened to that person after, right? So we just completed some research last year, and this was an Australian-based study where we sought out people who had really close calls in RIPS. And the results were pretty staggering. Because again, in my mind as a rescuer, I got that person back to the sand, that was done. Well, what happens to these?
That's where it ends.
That's where it ends for me.
In the lifeguard perspective, right?
That's right.
Another rescue,
That's right. Going, yeah. And so, as we start talking to these people, the data that's coming out is saying there's a variety of responses. Sometimes people are fine and they don't really understand, how close they were, or they do and they can, psychologically move on. Other people go home and propose to their girlfriends. Other people go home and, reconcile with their parents. Other people never go in the ocean again, terrified of going in the ocean again. Other people go as adults and say, you know what, I'm not a very strong swimmer. I'm going to become a better swimmer. And they join an adult swim, program, or they join a master's swim group. And so the actual impact of these events is a lot bigger, I think, than we ever think it is.
Absolutely. And I think, correct me if I'm wrong, defining it opens up a whole opportunity of realizing some of those impacts. And then within the process and the definition, now you're identifying, so drowning we just realized is a lot more than most people think. But within that block of the process of drowning, right, entering the water, having struggle, having impairment of your airway, and some kind of lasting or non-lasting effects afterwards. Within that, there is the tertiary psychological that comes even after that.
Yeah.
But then, correct me if I'm wrong, there's a preliminary study zone of going, hey, what are the preceding factors where someone's going to get into that process? And that is an entire world.
Yeah.
The process itself is an entire world of doctors and airway and how the lungs work, how water gets in, laryngospasm, all that stuff. But then there's also, now we've unlocked this psychological factor that happens afterwards, which is like mental health, right? Lasting, like PTSD, let's call it, from a traumatic event, all that kind of stuff. So we've just opened up Pandora's box of why this is so important in defining and being on the same page, and then realizing that there's a lot more to it, which, let me tie it back in regarding the project before we continue to digress here. That's the importance of lifeguarding, of awareness, having these studies, having people like you who are building those bridges, and then having that understanding be collaborative. Because this is, and you say it in this, the dissertation, it's a multi-sectoral issue, right? What we've just realized is it's complex. It involves all aspects of communication of different public entities, legislation, study groups, research, stats, lifeguarding, prevention, and it just opens up this whole Pandora's box of what needs to happen, right?
Yeah.
And
so the word that you used there was complex, right? And it is complex for a number of reasons. One thing that I think is really important for those of us who are lifeguards and or working in drowning prevention, this whole conversation, we're talking about some pretty heavy stuff: death, non-fatal, psychological impacts, right? And so it's really important, I think, for us to also remember that the water, the ocean, the pool, the lake, the river, wherever people recreate, it's also awesome, right? Like you and I got into lifeguarding because we loved the water. And so I think it's really important that as part of this conversation, there's not only we prevent bad stuff from happening, but we also promote and want lots of people to get in the ocean and experience what it's like to feel really small, or visit a river and have a serene, calm, peaceful experience with your family, or go to a backyard pool party with your family, right? Like, we don't want to prevent these things from happening. We want more of this stuff to happen. And so, we don't want to like completely be the fun police, right?
Absolutely. And I think that's a perception of lifeguarding, that from the beach perspective, when people go, we are thinking of the bad stuff to give people the opportunity to live the good stuff, right? Sure. But they come in, and when we go, hey, you can't dig this hole on the beach, or I need you to move your entire family and all that stuff you just set up 200 yards that way through the soft sand, and there's no space available on the 4th of July, right? Because you're set up right in front of the rip current, and I don't want you to drown. They are thinking we're like you said, the fun police, or we're doing something negative. But in reality, it is a positive, preventative interaction.
Yeah, that's right.
Right, but I think part of that is the awareness of people knowing where we come from as lifeguards for that side of it. So, cool. Let's get into. I was able to, for those that don't know what this looks like, that are just listening, there's 351 pages that the lady at FedEx was wondering how she was going to drill through for me to get like ring binders and everything. But I did actually read all of these pages, and the way it's structured made a lot of sense to me, where basically you take, all of these ideas we're kind of talking about, and you correlate them into a structured order through chapters, and the chapters build on defining the problem and progressing through a public health approach on how this issue can be not just defined, but then effected and researched, and where it's kind of solving the problem in a way without saying we're solving everything here, because there's so much to go through. So let's touch on chapter 2 in here, where it's the coastal drowning scoping review of burden, risk factors, and prevention strategies. What does that mean to someone who just hears those words?
Yeah.
Right?
So when you start a PhD, it's pretty important to understand and know what has already been done in the field, right? And so what I decided to do was read every paper that had ever been written on coastal drowning.
How many roughly?
And there's a couple guardrails, because like that becomes quite big quite fast. So we put a couple guardrails on it and define that. And so it ended up being about 150 papers going back to the
that qualified for what you were looking for.
That's right. That's right.
You went through a process. There's details I'm not putting here where every part of this, and sorry to interrupt, but every part of this, these chapters we talk about will actually identifies what qualifies, what doesn't qualify. There's a lot of details, but someone can read that. I don't need to talk about it on the podcast.
You read it right before you go to bed. Better than ZQL. Yeah.
But yeah, so 150.
Yeah, so I ended up reading about 150 papers, and it took me 4 months to do. Right, and in each paper, I built this form where you chart and you basically can start to catalog what had been studied and what hadn't been studied. And there were a couple big takeaways. The biggest takeaway is that almost all research exclusively happens in high-income countries, right? So the U.S., Australia, New Zealand, UK, kind of combined to form the bulk of coastal drowning research. And we know from other studies and estimates from the World Health Organization that upwards of 93% of all drowning happens in low and middle income countries, right? And so there's this huge disparity and gap of countries that have research and countries that don't, and then of course where the problem is. And so then the question becomes, if Will does this study focused on California and Australia, is it applicable to somewhere like Tanzania, Mozambique, Ecuador, wherever.
You name it, right? Yeah.
Right. And so that was, one of the big lessons or gaps that we found. The other, there's a bunch of other things, but one of the other really big, interesting pieces that we looked at was prevention strategies. And so usually in a research paper, you do some science and then at the end, there's some recommendations, right? And education absolutely dominates what people think we should be doing to prevent coastal drowning, right? But there's almost no evaluation of these coastal drowning prevention efforts. So the recommendation would be, we should teach every school kid about a rip current. And then, there might be a beach safety school program or something like that, but there's very, very, very little out there that's actually evaluating these initiatives and these efforts to saying, hey, this is working really well, this isn't, or you guys just spent a bunch of money and it's not working at all. And so there's this huge gap here in what we know works and doesn't work.
Yeah, and we'll talk about that later too, where sometimes those education, and there's a whole chapter dedicated to it as well, where that education doesn't necessarily, what you're saying, translate to the actual behavior change that a human needs to do to effect that process in real time in the real world, right? So, wow, yeah, I mean, that is, it seems daunting, right?
It was.
When you, besides for you, who thanks for putting the time in for all of us to be able to just listen about it now. But I think that is so crucial in setting the stage once again, not just defining this problem, but going, well, look at these disparities and the gaps in this, which opens up then, okay, what are we going to do about it, right? And I think that's how you start building off of this with the following chapter. So chapter 3, mortality trends and the impact of exposure in Australia from 2004 to 2021. I think a big takeaway here from this one for me, even as a lifeguard and not thinking about it too much, but when I was reading it, kind of going in hindsight, is explaining what exposure means and the importance of exposure within that context. So tell me about that.
So this study was an epidemiological analysis of death data from coastal drowning incidents occurring around the whole continent of Australia. The really important thing here is this idea of exposure. And exposure is basically the opportunity or chance to have something go wrong. So let's talk about a different issue. If you don't own a bicycle and you don't ride a bicycle, you are going to have very, very little opportunity to have a bicycle accident, right? In the same sense, if you don't ever go to the beach, or you go to the beach once, you have less chance for something to go wrong, basically. And so for this study, one of the things that we did was we paired a national survey from Australia with death data. and we figured out, different age groups and where people were coming from and the different activities that people were involved in, and we tried to link those together, which gave us kind of a new view on who was at risk, what activities, people were at risk, because it accounted for time, right? And so some complex math was fun for nerds. But yeah, so we continued to explore this idea of exposure.
And another thing I found very interesting on this one was the drowning rates through that time period, 2004 to 2021 in Australia. The drowning rates did not change, even with a significant investment in the preventative safety and education side, which is kind of building off what we were talking about in the previous chapter. Can you touch on that?
Yeah, so just to further define what you're talking about, we're only looking at coastal drowning rates.
Correct.
And this is an interesting piece. So there's two ways to look at this. The first way is drowning rates are not decreasing. That's really a good thing because they're not increasing, right? There's been no change over that whole time period. There's been no change, and the world has gotten infinitely more complex. Regional areas are now becoming urban areas. People are going and visiting more remote sites. The exposure equation has become a little bit more complex. So on the first hand, really good that these rates are not increasing, right? On the second hand, there's a huge effort in the U.S. and Australia, New Zealand, a lot of these places, coastal drowning prevention is a really important issue. And the fact that these rates are not decreasing is a bit concerning. Now, if we zoom out a little bit and look at all drowning, and I'm going to use Australia because that's where I live and that's kind of where my work and that's where a lot of the research has happened. Drowning rates in Australia overall have decreased over that same time period. And there are certain slices that have actually done really well. Kids, for example, children 0 to 4. The drowning rate in Australia for children 0 to 4 has decreased by almost 60% in the past 20 years. That's like remarkable. That is an incredible success story. Right?
And that's huge because most people don't realize, I think, that age group is specifically at higher.
Very high risk.
On a global level.
That's right.
Correct me if I'm wrong.
Correct.
Okay.
Yeah. And so, the finding here that, coastal related drowning hasn't really decreased in that time causes us to start asking some questions, and there's some interesting conversations around this issue. But
yeah, and what we talked about too, and I'll bring it up again on that, which I believe was part of this chapter, was the education is the primary focus. Australia has robust education that's being put out for certain things, life-saving, all of it. But the behavior change remains elusive.
That's right.
What do you want to...
Yeah, so basically what we're trying to say is, and maybe we can jump to that to other study. This was a quantitative piece, right? Numbers, counting, right? That only gets you so far. You can only learn so much by looking at numbers, and I'm a numbers guy, right? We did another piece of work that followed a qualitative model. And the difference between quantitative and qualitative is quantitative asks how much or how big or how small or when. Qualitative asks how.
And you used an example
why.
with me earlier of the kids in the cliff and that kind of thing. Tell me what.
Yeah. So a secondary study that we did was my colleague Amy and I, we went into a high school in a coastal suburb north of Sydney. And she took the girls and ran a focus group with the girls, and I took the guys and ran a focus group with the guys. And so these are, the equivalent age would be like kind of 8th graders, 7th, 8th graders for the US. And so I'm sitting around this table with a bunch of like Aussie beach kids, right? So fun, super fun. And I got to lean into the fact of like, hey guys, I go to the beach, but I'm not from here. Like, you got to tell me about what your life is like.
Nice.
And for those of you that are talking to middle schoolers right now, it's a wild time to be a middle schooler. I think it's always a wild time to be a middle schooler, right? But
absolutely.
Anyway, so we're talking about beach safety and why they go to the beach, and do they really care about going to a lifeguarded beach, and why or why not? And this all was in a context of, if we're going to develop an education program for your age group, like, what are the types of things do you think would be effective? What do your friends need to hear? Because you're fine, but like, let's talk about your bonehead friend, right? Mm-hmm. And one of the interesting things that they came back was, they said, look, we know that we should swim between the flags where the lifeguards are. We know that we shouldn't jump off cliffs. But you know what? We don't really care. We're going to go to the unlifeguarded beach because it's more fun and there's better waves there. And we're still going to jump off the cliff, right? And so it was like this really interesting moment where, you know, a lot of education efforts are trying to get people the knowledge. What these kids said is, we've got the knowledge, we don't care, right? And so that causes us to go back and say, all right, let's change our approach here. And the goal isn't to educate and improve knowledge. The goal is actually to motivate a decision, which motivating a decision with, you know, middle schooler is hard enough, right? But it has caused us to rethink how some of these, you know, education or some of these school programs should be run.
And another thing you brought up in that chapter is with these age groups, they don't want to know, when that's basically what you're describing. Like, I don't want to know what. I know that I'm supposed to be between these flags, or that flag is a rip current. This is a black ball flag. I shouldn't surf there. Yeah. But that this age group wanted to know the how or the why, and you had in quotes there, one of the quotes from these kids in the paper here that says, "Give it to me straight."
Yeah,
right?
That's right.
Like, I know that, but why? And I think that's such a critical component of, once again, tying it back to lifeguarding, where our role, if we're making a safety contact, and newer lifeguards, I think this is where the difference happens between an experienced lifeguard and a newer lifeguard in delivering a message, right? And having that in mind where, hey, don't go there, you're gonna die. Doesn't really work.
Yeah.
But if you go, hey, did you guys know that if you went here, you could have way more fun? Yeah. You know, this, and this fact will lead to a better outcome. And if you go here, the reason I don't want you to go here is because, hey, we're low staff today and there's only me for this entire stretch of beach. I actually just can't see this zone from the cliff over here, and it's super dangerous. I want you guys to have a good day. Yeah. And that might, in my rudimentary experience, from a social aspect, affect that change or that decision, where someone maybe empathizes or sympathizes with you. Yeah. And going, oh, okay, that makes more sense. I'm not just getting information stuffed down or put in my face as education. I actually kind of care about this a little bit. Right. I want to make a change.
Right. And what you're saying is actually backed up by some of the research that we've done, which is, don't tell me what to do. Tell me like how and why. Right. So in that safety contact, instead of saying, don't swim here, you're going to die, you say, hey, come here, guys. See that? Like, see the dark gap between the waves? That's a rip current. Like, that water is literally moving backwards. Like, if I'm a good swimmer, if I was to get in there, it would suck me out the back. Like, not a good spot to swim, right? And so just going that extra layer and explaining the how and why, at least for this age group, that's what they told us that they needed.
Well, and I would argue for
maybe some older people,
every age group, they just have their way of accepting that information, right? You're going to get down lower as a lifeguard, take your sunglasses off and talk to the little kid differently than an adult who you might, say it in a different way. And I'm going to digress here for 1 second with a story that just came to mind regarding this. The cliffs in San Diego, in San Elijo State Campground where I was working, and roll up, we have a headquarters there that has, the foundation is literally sticking off of the sandstone where it has eroded over the years, and we used to be able to drive a Jeep in the front of it. So there's a substantial portion of the cliffs that had eroded in a short time, and there's rocks all over the place that are falling. And there's a family set up right underneath there with their towels right next to massive rocks that had fallen off of this cliff. And I turned the corner in the lifeguard vehicle and I say, hey, sir, how's it going? My name's Roscoe. I'm a state lifeguard. I just want to let you know that you're set up right below this cliff. It's made of sandstone and it falls frequently. And at the very least, I don't want your surfboard to get dinged. But I also, want to advise you should move your stuff forward on the other side of where my Jeep is, so that in case if there's a cliff collapse, no one gets injured in your family. And his response is, oh, thanks. I know. I'm a geologist. And in that moment, I was going, okay, there's, I did my part. I tried to educate, tried to do this thing.
You should know.
Well, exactly. And I just said, thank you, have a nice day. I couldn't convince this guy to move, but that I think could be applicable and maybe a situation that all lifeguards run into, which is I gave you the education. Yeah. Man, I gave you that age-related version and a professional explanation, but then people still the behavior doesn't follow. right? Because of whatever reason unfolds there. And I think that's super important. And that's a challenge to lifeguards, but that's also a responsibility of the public to give the lifeguards the respect of knowing that that awareness is actually critical. And, you know, look, there's definitely a bunch of stories where people have gotten severely injured, if not fatal accidents, from cliff collapses in San Diego and in that North County section. So that was one that just for me personally was very interesting to say the least.
Yeah, and so like we can, I mean, it's a great story about somebody, a geologist, right? Of all people, you should know that this cliff is going to come down. But it makes me think a little bit more about the way that we approach education. And I'll go back to that piece of it's not just awareness and knowledge alone. Like we need to be thinking about what are the motivators and the drivers of behavior that are actually going to make somebody make a decision. Like smoking is the classic example. We could tell people smoking is going to cause cancer, blah, blah, blah. And people didn't stop smoking, but we got pretty clever and said, hey, no one wants to kiss a smoker and you're going to have bad breath and your teeth are going to fall out. And the vain humans that we are, that's like really when we started to see a decrease in smoking. And so, as we think about in our world, in our beach safety world, in our drowning prevention world, like how do we level up some of these education efforts?
Absolutely.
And we, again, as a researcher, I'm obligated to say we need more research. That's what all researchers are trained to do, right? But like this is where science and evidence and these sorts of studies can actually really provide some valuable information.
Well, it's a mutual relationship to having the data, having the science, but then being able to put that into training and right, like for the lifeguards to learn from that and the researchers and data to learn from and bring it back and forth, right? It's a mutual collaboration. Let's go into this because this is a big section. Definitely wanted to talk about on chapter 4, the burden of fatal drowning in California, 2005 to 2019. I think this is very applicable and very important. And I'm just going to list a couple things that I wrote down in that time frame, 2005 to 2019. 9,237 fatal drownings happened in California, and correct me if I'm wrong on any of these numbers, and about 616 per year. Males were 2.7 times, let's call it 3 times more likely, or no, not more likely, in the numbers, drowned more often fatally than females. And I believe that also applies to the world as well as a general statistic that males are more likely
to drown.
The highest rates happened in the areas with the lowest population.
Rural and remote areas.
Which is very interesting to me. And then a lot of the age groups that were also most represented in fatal drownings were the older population between 75 and 84 years old and those of the younger populations between 0 and 4 years old. Talk to me about what you found in this section of it, because this is a huge chunk on the burden of fatal drowning in California.
Yeah, so this was a big piece of work and also really meaningful to me, right? Like as a Californian, like this was a really cool opportunity for me to learn a little bit or take some of the stuff that I was learning in Australia and apply it back to my home state. And this specific piece of research actually happened in a larger context. So before I moved to Australia, in my role at Hoag Hospital, I started working with the Ben Carlson Foundation, who I think you guys have talked a little bit about on this podcast. And I had a really great conversation with Chris Carlson, Ben's dad, and John Moore, who is on the board, and Jen Fox, who's also on the board. And we started having this conversation, and Chris came to me, and they said, we want to do something big in the drowning prevention space and in the beach lifeguard space. And I kind of turned it around and said, well, Chris, like, what do you think? And he had this really interesting observation. As a newcomer to the drowning prevention ecosystem here in Orange County and bigger in California. And he commented on how there were lots of people doing lots of really good work and no one was talking to each other. Everybody existed in their little silos. And so we thought, hey, that's like, that's a pretty easy problem to solve. Let's buy lunch and, get everybody in the same room. And so we hosted an event in 2019 and we called it the Southern California Water Safety Summit. We had, 130, 140 people in Newport Beach. Awesome event. And it actually seeded a conversation that people wanted to do this more. They said, it's pretty ridiculous that we haven't been able to like collaborate on this level, in between different regions and different counties, but also in between different parts of the drowning prevention ecosystem, for lack of a better word. And when I talk about that, I want to go back to this multi-sectoral piece, that drowning is a complex problem. And if you think that you're going to solve it from your perspective as a lifeguard or your perspective as a pediatrician alone, you haven't really fully grasped the picture. And so in this room in Newport, we had firefighters, pediatricians, researchers, ocean lifeguards, pool lifeguards, swim teachers, public health people, right? We kind of had the mosaic of drowning prevention all in one space. And so, we had this, we were planning another event actually for March of 2020. Again, there was another big global event that happened in March of 2020. And so we ended up having to cancel that, but it gave us the time and the space to take a step back and say, okay, should we look at developing a body that can help all these drowning prevention agencies, organizations, groups collaborate? And so we spent about 6 months listening to a lot of people from different sectors, from different regions of the state. And the answer was, yeah, we should try and do it. So we put together what's now launched as the California Water Safety Coalition. And it is a multi-sectoral body that serves as a kind of meeting ground, a platform for drowning prevention in the state. And ocean lifeguards are a critical part of that, a pillar of that community. And so this, going back to the research, this work was really informative to try and guide some really high-level priorities for the organization itself, but also for drowning prevention as a whole in the state. And this work really was the foundation for a document that was launched last year, the California Water Safety Strategy, which Drasco has some pictures in. Thank you. Which is a high-level document that guides action, right? And so, yeah, back to the research. This was another epidemiological analysis where we looked at fatal drowning, again, only deaths, across the state over this period. And we found, like you previously mentioned, kids, high risk, older adults, high risk. Rural and remote areas are a really important area of focus that we need to be thinking about. I think beach lifeguards, especially in Southern California, we think we're the center of the universe, right? We're not. I hate to break it to you. Northern California, the Central Valley has a pretty big drowning problem. And I, as the beach guy, right, like my passion is coastal stuff, beach stuff. 26% of the drownings in this state occur in rivers. Like, what are we doing about river drowning prevention? There's definitely some work happening out there, but not nearly as much as what's happening on the beach. So starting to think a little bit more critically about, what can and should we be doing for some of these inland bodies of water to improve safety, across the state.
Yeah, absolutely. And pools as well, right?
That's
huge.
Right.
And I think this is a good time for me to turn to that section where I had that all those numbers kind of outlined here of the. Let's go here.
This is the different bodies of water, right?
So just the little blurb I think is super important to share here. California, the most populated state in the USA with nearly 40 million residents, has thousands of miles of ocean and inland lake coastline, nearly 200,000 miles of rivers, and over 1.34 million swimming pools.
Right, a lot of water.
Previous studies in the 1980s and 90s identified characteristics of the California fatal drowning burden, but we are not aware of subsequently published peer-reviewed studies specific to the state.
Yep.
The lack of recent and available in-depth analysis on drowning in California makes the size and scope of the burden unclear, which is basically what we're saying here. And then this is the other part that I think is interesting. The Centers for Disease Control and California Department of Public Health, they provide publicly accessible data related to it. And this is, I think, a nuanced piece, which is, but these surveillance tools are not designed for research and do not include characteristics of the drowning burden that would be helpful for drowning prevention interventions, policy and regulation, and research.
Yeah, and so what we're talking about there is that the data that's public facing is really high level, right? We can do things like identify kids are a high risk population, or maybe a certain county is a high risk area. But what we need in order to develop prevention strategies and initiatives are those details, like what was the person doing before they drowned? In a backyard pool, was that pool fenced? Was the fence working? Was it, did it have a hole in it? Was there parent supervision? At the ocean, how big was the surf? Was it lifeguarded or unlifeguarded? These are the sorts of details that we need to be able to develop prevention measures. And in a lot of areas, we don't have this. One of the really exciting pieces that is happening is the California Department of Public Health is embarking now on a drowning data surveillance pilot program
for younger.
Yeah, so
right?
it's focused at kids. It was originally focused at kids, but it's actually going to be a little bit bigger. They're going to look at all ages now, which is a huge win. I mean, we're the only state that's doing this, and so for the next 2 or 3 years, you've got the Department of Public Health investing in and looking at how can we improve drowning data, and then the really actually important part is how do we take what we learn and do something with it. And so, that is an enormous win for our state. And I know that there are other states and even other countries now looking at this project.
Yeah, absolutely. And I think this is, for me, real evidence of you went in, and this is one chapter of the paper, right? But you went in, did the study, created with the help of everyone else involved, obviously, California Safety Coalition and the safety strategy, and this is now starting to make a change with the public health department. Right?
Sure.
And this is what we're identifying is regarding the scope of the problem. Here is one thing that's now moving that forward, which
and
thanks for taking
look,
the
like
time.
I'm like, there's no way that I'm going to take credit for getting that specific project off the ground. But I will say, I am a firm believer that we are more powerful together. Right? 2 + 2 in this sense usually equals more than 4. And what I mean by that is as we get all of these different parts of the drowning prevention ecosystem together, speaking with one voice, moving in one general direction, powerful stuff happens, right? And so it's critical that, the ocean lifeguards remember to see themselves as part of a broader community. And again, that has been one of the areas where Chris and the Ben Carlson Foundation have been a massive bridge builder. Massive bridge builder is by facilitating the entrance and the collaboration between these ocean lifeguard agencies and the broader drowning prevention world, which is focused on pools and kids and other areas. So, good things are happening.
And just to say there, in our partnership with the Lifeguard Project, right, they're recognizing there's, like you said, there's a bridge here to be built to communicate and disseminate this information to everyone and have everyone communicate, which I think that's what you're describing in the drowning prevention world and research and all that we're talking about today. But then also in the lifeguard world, hey, lifeguards, we need to get together, talk to each other. How do we do all of these things as one pillar of the greater whole, right? There's one other detail before we leave this chapter on California, which I thought was super interesting. The proportion of drowning deaths was highest during the summer months of June through August at lakes and ponds, which is qualified with 50.5%, pools 47.6%, and rivers and canals 41.4%. Seasonality was less pronounced for bathtubs and coastal sites. So there's another lifeguard detail there.
Yeah.
Seasonality was less pronounced for coastal sites on the California
That's right.
drowning data, meaning the summer had nothing to do with.
No, not nothing. I mean, I would say if you look at the spike in summer drowning in pools, lakes, and rivers, it's quite pronounced. But when you look at coastal sites, that line is a little bit
less.
It's more flat.
Meaning there's still stuff happening in people consider the
winter
season,
quote unquote off season.
Yeah.
Yeah, that's right. And so, and again, remember now that we're only looking at deaths. So we're not looking at non-fatal incidents. We're not even looking at rescues here. And so
this is just people who died from drowning.
And so when you think about multiplying that by 3, 4, 12.
Wow.
The lesson from this is that there is no off season, right? Like in ocean spaces and ocean drowning prevention, there is no off season. Yes, sure, you're gonna have a lot more people in the summer. That's great, but there's stuff still happening in January and December, right?
Yeah. Wow. Yeah. Let that one sink in for a second, right? But this is why we're talking about it.
And this again, like Josco, I got to say, like the Lifeguard project originally started with your brainchild idea to do winter photos.
Yeah,
right.
That's correct.
To try and show this offsite. So like again, I guess now we've got some numbers and some art, and that is the bridge here.
Yeah, and for those that don't know, all the pictures that exist, at least at this time, I haven't shot any photos during the summer yet.
Right.
Of lifeguards.
Right.
Everything that you're seeing about the project, as of the posting of this podcast on the website, all the stories that are coming out, has only been shot during the winter. Mm-hmm. So that's even that, and there's a lot of action that has already been captured there. So yeah, there's a lot there, but let's move forward. This one I definitely wanted to touch on for chapter 5, and I'm going to let you take the reins on the explanation. But basically, it is the relationship between tides and fatal drowning in Australia. And it was
one state.
Tell me, it was specific to
New South
Wales.
Yeah.
Before we get into this, because I know what this means, but I want to set the stage for everyone to understand. Define for me first what tides are, and then what rip currents are, and then maybe touch on rip tide as the common nomenclature. So,
all right. So we'll start with the high level. In its most simple form, the tide is the difference in elevation up and down of water in a coastal space that's driven by the gravitational forces of the Earth, the Moon, and the Sun. All right, go online, look it up. There's some pretty nice little videos out there. A rip current is a seaward moving flow of water that usually occurs in a narrow band that moves from the beach through the surf zone out to the ocean. And rip currents are driven by wave energy. So any beach with a wave, you're going to find rips. There's a lot more science there.
But now tell me, I'm going to interrupt you. Now pretend like I'm just someone you're doing a safety contact. What's your rip current spiel as a lifeguard when you're explaining to them?
Hi, my name's Will. I'm a state lifeguard. How are you? So a rip is water moving away from shore. And it's like a river in the sea. Look out there. Do you see the gap between the waves where the waves aren't breaking? That's water moving out. Or do you see that big brown sandy, colored current moving out? That's going to take you backwards out to where you can't touch.
Yeah, nice. Right?
So a lot of people refer to rips as rip tides. It's not a tide. That's a little bit of a misnomer. And so the motivation for this study actually goes all the way back to when I was 16 years old, sitting in the lifeguard training room. And there's this really common belief, in the lifeguard community that rips pull faster, more frequent, and stronger when the tide is dropping, right? That's what I was taught. And so this study actually came out of the discrepancy between what I learned as a lifeguard, what I was told as a lifeguard, mantra, right? Like lifeguard folklore. Oh, big drop in tide this afternoon. Everybody get ready. It's going to be crazy.
Lifeguards, prepare and sit down if you're listening to this right now.
And so as I started digging into the rip current science, I couldn't find, and again, there's lots of different types of beaches in the world. We're talking about microtidal beaches. This is a beach with 2 meters thereabouts of tidal elevation flow. We're not talking about mega tides in Canada and the UK and Alaska, right? We're talking about Southern California and New South Wales. And so in the rip current literature, I couldn't find this fact, quote unquote, where rips were stronger, more frequent, and faster at low tide. And so I started talking to my boss, Rob, who I was talking a little bit about earlier, and he said, oh yeah, rips don't flow faster at on the outgoing tide. Like, where'd you come up with that? And I said, every lifeguard that I've ever met. And so what this study was is basically trying to put that to the test, right? And so we took fatal drowning data from 15 to 16 years in New South Wales in Australia, which has a very kind of similar beach profile to many beaches in Southern California. And we linked them. We basically figured out what the tide was doing when that drowning event occurred, and did a big test. So, basically what we found is that there's no relationship as to whether the tide is going up or going down. It's all about water levels. If it's lower tide, regardless of if it's going up or going down, drowning is more likely, incidents are more likely than at higher water levels. And that matches with the rip current literature.
Yeah, and just to clarify, this is for fatal drownings, not rescues, not safety contacts, not beach visitation, all that stuff.
Yeah, so this is a really thin slice of this question, right? And what you're bringing up, makes us, well, if we know this about fatal drowning, is it also true for rescues? Is it also true for non-fatal drowning? Does it impact, people and blah, blah, blah?
Yeah.
So really thin slice of this question, but we could not find the relationship between a falling tide and an increased likelihood of a drowning event.
Yeah. And like you said, most of them happen regardless if it was higher or low tide, at lower water
water levels, that's right.
And the part that I highlighted in here that I wanted to touch on regarding this, that's going to stir up some lifeguards when they're listening to this, which is great.
Yeah.
But that brings up hey, what's the actionable from this? And to me, this is relating it to like planning our trainings.
Staffing.
Are we teaching stuff in our trainings that are backed by science and research and data? And unfortunately, we just don't have that right now for lifeguards.
Right.
But if we're talking about drowning,
so there's
and this huge problem.
You're right.
Hey, well, we need to have some data on this. So, hey, are we teaching this because we just developed in our culture of seeing stuff and, randomly something happens now, you think that's always going to be that way, right? You're conditioned.
Or you were told.
Or you were told initially and didn't question. So I think that's the implication here, and you have this in one of the sections for ocean safety management is let's look at studies and data for this to be able to implement that into our training and stuff. And I do want to say at the end, for any of those haters that can say, Will's wrong, there's no way, I know
there's a couple nuances here.
You have some qualifiers in the end that are saying the analysis occurred at a macro level, did not examine specific locations where times and falling water levels may actually alter
That's
the
right.
risk.
So we looked at a state. We looked at the whole state.
Exactly.
Right. And so one of the obvious places where this is not true is anywhere that there's an opening, an inlet to an estuary or any sort of tidal water body. Mm-hmm. So anytime you've got a lot of water moving through a narrow channel, right, you will have a tide influenced current that is moving out to sea. So again, study looked at a state level, not at specific locations, and there definitely are those locations out there where a dropping tide is gonna play a factor.
Yeah, absolutely. Awesome. And you also said then no beach is the risk of drowning determined by the tide alone.
That's right.
Right. So I don't want this to be too dramatic.
Totally. Like if you have the recipe for drowning risk, like tide is going to be a really small sprinkle. There's lots of other stuff happening there that are really important.
Absolutely. This kind of, for chapter 6, trends and contributing factors for tourists in Australia. We've kind of talked about this, but this looked into drowning for tourists that showed up to Australia, visitors. And you qualify, who qualifies on that and all that stuff. But there's a couple things I highlighted just to set the stage for it real quick. Australia's 4th largest export sector was international tourism.
Pre-COVID.
Correct. Yeah, let's definitely. Yeah. But COVID is a factor here because right now we're on the other side of it. Yeah. So a lot of this stuff is almost
booming back.
Correct.
Right.
So pre-COVID, Australia's 4th largest export sector was international tourism, more than 45 billion Australian dollars per year. 6 of the top 10 Australian tourist attractions are related to aquatic or coastal experiences. An estimated 70% of international visitors to Australia participate in coastal activities during their trip and globally. In addition to the commercial sector, national, state government, tourism bodies heavily promote Australia's beaches and coastal activities.
Yep.
Which
you go to Australia, you go to the beach.
You could say the same.
Reef.
I would say California is similar in what we're describing here, right? Large tourism industry. I mean, not even to mention now we have just with Instagram, social media, people traveling more after COVID, right? This is obviously a huge conversation. Without going too far into the facts and the rates and all that stuff, the thing that really stood out for me here was the question that comes up, which is if these entities are promoting these beaches, untouched Australian or California beach, pristine beach, right? Social media, you describe aspects of the digital ecosystem here with influencers, YouTubers, whatever, all these people that have millions of people watching that are going to actually, I mean, let's talk about someone who's making behavior changes. These people are seeing this and they're going to those places.
Yeah.
So if we need a behavior change for the safety of it, how responsible are these entities, hotels, Airbnbs, tour groups that are doing snorkeling, diving tours?
Yeah.
Like that was the big takeaway for me on this chapter. And what do you think about that?
Well, lots of things. Well, I've just got more questions, right? And so this is a bit of a philosophical conversation, actually, about whose responsibility is beach safety, right? We spend a lot of our time talking to individuals. That's the education piece. You should learn how to identify a rip current. You should swim in front of a lifeguard. You should put on your sunscreen, whatever it is. But we spend a lot of time talking to the public. I'm really curious and interested in system level change that doesn't depend on the individual, right? If we take an example from another part of the drowning prevention story, the 60% decrease in drowning rates in kids in Australia has a little bit to do with parent supervision. It has a little bit to do with water familiarization classes, but mostly that's a story about the success of pool fencing legislation, right? We're talking about population level, big picture change. And so back to this conversation about whose responsibility is beach safety. If a city paves a parking lot and is charging $6 or $16 with inflation now to park, are they responsible for providing for the safety of the people who visit that beach? If a hotel is building a bridge across PCH to a really dangerous beach, are they responsible to contribute to the signage or the lifeguarding or the public education that happens in that hotel? If Instagram is creating and maintaining a platform that allows the super boosted, posts about these virgin, untouched, beautiful remote beaches that aren't lifeguarded, are they also somewhat responsible for providing for the safety of people going to these places? And so, I don't have all the answers to these questions, but I would just say that I'm curious and I'm thinking a lot about that systems level change versus us only talking to the individual, because us only talking to the individual is going to get us, it's only going to get us so far.
Yeah. That is a huge piece, I think, that you said that's super important. So let that sink in. But we're at the forefront of this right now. Right.
Yeah,
and it's changing constantly.
I think we're continuing to think about it, right? And lifeguards are a really important part of that system.
Yeah.
Back to the parking lot example. If you're going to build a parking lot and you can fill it up with 300 cars in a place where there previously wasn't accessible, the layer of safety that should occur at that beach is a risk assessment followed by a lifeguard service. And so, it's back to this question of individual responsibility versus collective responsibility versus the responsibility of a business owner or somebody who's making money off of the beach, essentially.
And all this correlates back to everything we've been talking about, right? And that's why it is such a complex issue, right? I mean, we're talking about now money issues and laws and who's ethical and philosophical conversation within that. So, which is why it's fun to have a conversation about it. I'm going to leave this chapter with just a couple facts that you had in here for a couple other places in the world regarding visitors. In Greece, about 1/3 of the drowning deaths from all water sites were foreigners. And these are all backed by studies and things. Spain, it was 19.2%. in Costa Rica, 38% of coastal drowning deaths were international tourists.
From the U.S. in Costa Rica, most of those drowning deaths are American and Canadian citizens.
Oh,
Right.
okay.
And so that Costa Rica is a really fascinating example, actually, because it's a place where the U.S. Embassy actually has gotten involved in beach safety.
Really?
Because, there's a problem there.
Yeah.
There's a money problem there.
Yeah.
Right. Which brings up several interesting questions about the role of funding and, lifeguarding services. And, it's when a bunch of American tourists are drowning, that's when it becomes a problem down there. So we'll leave that one for now. But
we don't need
Costa Rica is a really interesting example of really complex coastal safety situation.
Thanks for adding that in. And lastly, in Kauai, 73% of drowning deaths were visitors. I think that's very interesting and good to know. And once again, what an incredible thing. This is just one chapter of the entire paper, right? But it unfolds so much, and that was what was incredible for me reading through this was each chapter as a lifeguard, going through each thing, going, well, I've experienced certain aspects of what he's talking about here. I had to look through some of the graphs and kind of scratch my head on some of them. But once I got through it, I'm going, wow, man, this just opens up. Each one opens up conversation.
By the way, for anybody listening to this, Drasco is the 5th person, maybe 4th person, to read this thing from cover to cover. I'm like my wife hasn't gotten past page 3 yet. So I have to say, man, thank you for your interest. I don't know what you're doing with your time, but
it's filled up, to say the least. But it was super interesting, I think. And this is the point of awareness, to bring this to people. We talked about the high school kids and everything. As we near the conclusion of this, surfers. Yeah. Chapter 8 talks about the impact of a surfer rescue training program in Australia and New Zealand. What some people here in California correlate to like the SALT.
That's right.
Surfer.
Very, very similar.
Yeah, SALT programs. But basically it's when, and correct me if I'm wrong, when surfers can go and get basic rescue techniques, basic levels of awareness of what rescues look like, and trained professionals can teach them certain aspects of that, how they can make a rescue with a surfboard, who they should call for help, basic things. Sometimes CPR is involved with that, right? Why are surfers such an important aspect of this, and why was this a studied portion of your paper?
Okay. So I hear all the time from people, you can't put lifeguards everywhere, which is mostly true. I mean, you go look at the northern coast of California, and that's one way to put few lifeguards over a big area. That's a different conversation. But surfers are an interesting population because they are there before lifeguards go on duty. They are there after lifeguards go off duty. They are there in December when there are no lifeguards at certain beaches. It's also they represent a really thin slice of the population that actually have the ocean skills and the aquatic competence to successfully and safely carry out a rescue, right? They have the ocean knowledge to be able to understand waves, rips, currents, right? Most of the time they're surfing at a local spot that they know backwards and forwards. So they know that, on a south swell, this side of the beach is going to be dangerous. And they know that, when the wind kicks up in the afternoon, this or that or the other thing is going to happen. Lastly, surfers carry flotation devices. So even a boogie boarder, right, has a flotation device. And if you look at the drowning chain of survival, like this is the way to stop drowning, providing someone with flotation is the critical step in stopping that process. And so this program is a really innovative and clever initiative that, like you said, basically teaches awareness. It teaches really basic rescue, and then a lot of times they include CPR. And going back to our conversation, a little while ago, this is a great program in my mind. It makes a lot of sense. It checks all the boxes, but no one had ever evaluated it. No one had ever scientifically approached it and said, "Hey, is this working? Is this not working? How is it working? How could it be better? What's working well and what isn't?" And so, we kind of attacked this from a couple different angles, and the results were, one of the interesting things is that the program actually made people much more preventative, right? Surfers, more preventative. These are bystanders. So when Drasco and I were in lifeguard class, and then when Drasco and I were teaching lifeguards, new lifeguards, one of the ethos and one of the things that we really push on new lifeguards is it's better to make all your preventative actions than to ever have to make a rescue, right? Like preventative lifeguarding is the core of, lifeguarding, right? And so this course actually gives surfers the knowledge and the confidence to say, you know what, like I know that those people setting up, they have no idea about this rip current. So on my way out, I'm just going to say, hey guys, you're setting up in front of a big rip. I would suggest you go that further down that beach, and then they paddle out, right? Or they're sitting out in the lineup and they see the kids kind of floating out in the rip and they go, oh man, that's going to be bad in like 2 minutes. I'll just go paddle over now and say, hey, right? And so it actually made a lot of the participants much more preventative, which is going to be a good thing through and through.
Yeah, and I think that's huge. And like you said, the reason this is, people think, oh, I'm just a surfer, no big deal or whatever.
No, you're special.
There's a reason why you're taking a chapter of your PhD dissertation or thesis and devoting it to this, because there is value there, that it's not just surfing.
Yeah, that's right.
If you empower someone with a little bit of awareness and you give them a few tools, they can make a massive impact on this issue. And I want people to hear that. You know,
and anybody who's listening to this conversation and surfs very likely would have had some experience where they helped somebody, right?
Absolutely.
Like this is not uncommon. There was a study done a couple of years ago in Australia where they estimated that bystander surfers conservatively made as many, if not more, rescues than volunteer lifesavers and lifeguards down there.
Yeah.
And so, surfers have a really important role as like a population level intervention, right? This again goes back to systems. We're training a whole group of people that are there all the time.
It's like a pool fence for the ocean.
I wouldn't go that far.
But a version of a defensive
that's right.
barrier of
that's right.
People who are out there already. Yeah. And a thought that I had in my mind was, hey, what if you could get every surfer trained up, and if you do a salt course, you get a free parking spot at the beach, you don't have to pay the meter.
Hey.
Or you get some kind of incentive where you've been certified, you have this awareness, and maybe they'll just go through the motions of going through the class to get the free parking pass or whatever. But what the study shows is not only did they have instances before, after the study, you're showing that they had confidence to at least say something.
Do something, yeah.
But they also identified challenges in making those safety contacts, which is a huge portion of, once again, the public. But within that is such a value, I think. So how can we motivate them, and how can we incentivize that to build that extra additional barrier for, because the lifeguards have to clock out at some point, So yeah, man, that was, I think, very, very impactful. And that brings us kind of towards the end of the thesis here, which is discussing and concluding basically overall aspects of it. Just going to go through some of the kind of closing points that you had. Oh, actually, before I forget too, I just remembered my note. While only emerging the ability of future systems guided by artificial intelligence.
Of course, yeah. I had to put it in, right? Like
to identify rip currents is sure to be the next major frontier of beach safety research. Yeah. Some recent studies have reported preliminary results from such systems, and multiple major funding commitments have been announced in differing locations around the world to explore the issue further. So let's get a little divot on there on rip currents research and AI.
Yeah. Okay. Fascinating topic. And you want to talk about true nerds. This is true nerd stuff, right? So in December at the World Conference on Drowning Prevention in Perth, there's a group of coastal scientists together, and everybody's starting to explore and dabble in what this AI, what this means, right? And one of the big problems with rip current identification and even machine learning from the past 10 years is that you need to train the computer how to recognize a rip. So you have 20,000 pictures that requires a human to go on and do a lot of clicking, right? So that whole process is speeding up rather quickly, and there's some really interesting future possibilities with this technology, and it's pretty cool to see researchers from UC Santa Cruz and researchers from Christchurch in New Zealand and researchers from UNSW in Sydney and researchers from France and the UK all start to do similar stuff. Going back to the collaboration piece, actually, one of the coolest things that I got to be a part of, in the past couple months was I went through the registration list at the World Conference on Drowning Prevention and emailed all these people in one spot and said, hey, all of you people are working on AI rip current stuff. You should all be in contact. Go ahead. And now there's like a working group and they're meeting on Zoom at like all hours of the night.
You just did it unsolicited group text, basically.
That's right. And then backed out.
Leaders.
Yeah. And so like there's really interesting stuff here that's coming with, with this evolving technology. And, I don't really know where it'll lead or if it'll be super useful to lifeguards, but it will be super useful to coastal scientists who are studying erosion and wave patterns and all sorts of other stuff.
Yeah, well,
it's coming.
Yeah, for sure. So in closing, you bring up a lot of good points on here that basically
thanks for asking.
Close out the paper. Talks about researchers obviously increasing the research, the gaps that are there, all the faceted issues which we've discussed. For the one that I highlighted for lifeguards, because it's the Lifeguard Project, data from the scene of drowning is critical. Mm-hmm. Talk to me about that and how it can relate to potentially lifeguarding or just in research in general.
Yeah. So if we go back to that drowning timeline and we work backwards from death, right? In the worst case scenario, someone's going to die or have a neurological deficit for the rest of their life. But as you move backwards from that, there's different information available at different stages, right? So for everybody across the board, we're going to be able to figure out things like age and sex and where they drown and stuff like that. Maybe we might know their residence address so we can get some census information. But the critical information that we need to develop prevention strategies actually comes up from the scene. And it comes from data that's going to be collected by a lifeguard or by a paramedic who's on scene in the backyard pool. Oh, there they go right now.
Cue the medics.
Cue the medics driving by, right? And so, I guess in a simple form, what I would say is that the data collected by lifeguards is essential to someone like me running statistical models and tests to try and figure out where the trends are and figure out where the high risk and the high burden is. If we don't have that, it's really hard to go back and get it. And so if you are a lifeguard and you are bitching about your paperwork and you're really unhappy that you have to click through a form or you've got to fill out some bubbles, please know that when someone like me gets to put all of that stuff together, we're able to identify trends that will help make your job easier eventually, right? I'm able to put all of that stuff together and package it in a way where a city council is going to be able to make a decision about your funding agreement for next year, or your raise in 3 years, or your new lifeguard headquarters in 5 years. And so, I would just finish that by saying it's critically important that lifeguards understand the role that they have in research, and it's like all the way at the beginning.
Yeah, wow. And like you said, I also want to ask you with that is, like we were talking about the responsibility of tours, hotels, all that stuff, social media. How much of that responsibility falls on the lifeguard agencies versus someone to approach the agency and go, hey, we've got this study going. Like, do I need a researcher to come to my agency, talk to the chief and go, hey, here's how we're going to implement this study? Yeah. Or does the chief reach out or whoever, right? So I think how do we make that easy and
so
accessible?
I think it goes both ways. Lifeguard data collection is another topic that I've always been really passionate about. From filling out bubble cards and lifeguard towers to now a lot of that stuff is being collected automatically with computer systems, which is really great. I think it goes both ways. So if you're a lifeguard or you're a lifeguard, decision maker or manager or something, and you want somebody to do something with your data, like come find us. Like we'll definitely help you. The other interesting piece here for the lifeguard agencies is actually to be able to put data from different organizations side by side. And to do that, we've got to have the same definitions and we've got to have similar collection methods. And that process is continuing to happen right now.
Future projects, future research?
I'm like not doing anything for a little while. No. So I actually work full time in Australia now in a research policy role. I'm the national manager of drowning prevention strategy for the Royal Lifesaving Society Australia. So it's a national level kind of role where I'm charged with advancing drowning prevention strategy and initiatives and projects mainly focused on collaborative work. So I've got a full time job. Some of that involves research, but if I was to do like the dream study. If somebody was going to fund another PhD, one of the things that I would love to do, one, because it's my passion, and two, I think it's needed, is a deep dive on lifeguard effectiveness. And what I mean by that is all the lifeguards know what they do works, but that really hasn't been shown conclusively with data, right? There was a study that was done by the CDC 25 years ago. So that's a quarter of a decade ago that had some information in it, but what we know and the data available to us now is much, much better. And so being able to show, the effectiveness of ocean lifeguards in preventing drowning would be a good one. The other one I'm really interested now in as a Californian living in Australia with lots of experience with New Zealand and the UK would be a comparative lifeguard system study. So what elements of the Californian or the Hawaiian or the Australian or the New Zealand lifeguard systems are better than others, which works, which doesn't? I mean, I think there's a lot of really interesting questions there.
Yeah, wow. You dedicated this whole thing to Grandpa?
That's right.
And for those that are just listening, not watching, I'm handing Koon here a picture of a gentleman in a white t-shirt, looks like a backdrop of Mexico, holding two massive lobster with a straw hat and some shades. It looks like he's having the time of his life somewhere in the 70s. So what's the inspiration behind this dedication?
Yeah. So Grandpa died in 2022 in October. And I was really fortunate to actually be in California in his final few days. And I didn't come back for it. It was kind of a pre-planned trip that, and I had a really meaningful time with him while he was on his way out. Papa was always somebody who was there for me in a really special way. So I grew up with a single mom. My biological father was never part of my life. And so I grew up really closely with my uncles and my grandpa. And Grandpa lived up the street from me. And so I thought it was fitting for me to honor him. And this was a small way that I could honor him is by putting this amazing photo of him on the front thing.
So rad.
Grandpa in his prime, right? Yeah.
That's super cool. And yeah, awesome that all this work too that you did for it as well. Just the kind of some closing questions that I have on here and what you're talking about too. We spoke about it before. You've had an experience sometime in your lifeguarding career where you've gone out and made a rescue and there's impacts with that. But when the researcher, see that on a piece of paper or whatever, thousands of statistics, it's a one check mark.
That's right.
Talk to me about
sure. And this is where
being able to experience both sides of that.
Yeah,
right?
And this is where I think the role of the Lifeguard project comes out. Any of the lifeguards listening to this will resonate with a generic story of you see something, you burn out of the tower, you go save someone's life, and in your deep part of your soul that if you weren't there, that person was going to die. But you got there fast enough, and the person's freaked out, and you're a little freaked out, but it's all fine. Everybody's breathing. Nobody, no big deal. You get them back to the beach, and you leave them. That's like a very impactful big moment that gets reduced to a 1. Or let's think about a bigger issue. You do a CPR. You respond to a multiple vehicle collision on PCH as a lifeguard in your red trunks. Like that event gets reduced in the statistics world to 1, right? When it's so much more than 1, it's so much more complex than 1. And so one of the things that's really inspiring to me, Drasko, about this project and why I'm absolutely stoked to be sitting here with you and know you and be your friend, but also see where this is going is, with a picture or a story or a short video, you are able to communicate the depth and the complexity and the difficulty and the struggle of that event, where I'm looking at it in an Excel spreadsheet and it's one, you get to dive really deep into that one and make that human connection about the impact of that specific event, right? And that's something that I can't do with my fancy computer models. I can do big data and I can look at trends, and there's lots of really amazing stuff that math can do, but it cannot communicate that pit in your stomach feeling of knowing that if you had not been there, that person would have died.
Yeah. And thanks for that. But much like the difficulty of gathering all this data, reading 150 pages, and then some, sitting down and timing what time the tide through a coroner report and the fatal, and then correlating all that stuff and everything, the photographic side of it or the artistic side, people think, oh, that's a cool photo, whatever. But to translate that, right, there is that same complex, not the same, a lot less work, but a similar complexity of knowing what does a photograph actually translate for that one. You still can't, you'll never be able to translate the feeling unless someone is really there and they've experienced it for themselves, and the lifeguards can vouch for that. Anyone who's had a critical rescue, it doesn't have to be a critical rescue. I mean, there could just be something that tugs on your heartstrings that's simple.
That's right.
Right? But there's the same amount of complexity and difficulty in bridging that gap artistically and photographically to try to transfer some of that information forward. But it's much the same as bridging that gap between data and things. And I think you need that aspect, like we're saying, like of people to resonate with that from all of those angles.
Yeah.
Someone's going to understand numbers. Someone's going to understand a photo. Some other person's going to understand by listening to it.
Yeah.
And so that's hopefully the approach. And I think just to mention again, we talked about the Ben Carlson Foundation, but I think they're such a huge leader in combining and connecting all of these aspects within yourself and your relationship with them, within partnering with the Lifeguard Project. And they're recognizing that need, and you need that glue of someone who's able to support those bridges.
Yeah, that's right.
Right? And building those connections, because it's such a big issue, not just drowning, but lifeguarding and all of the other subjects that go and stem off of that.
Yeah.
And so
yeah, like you're right. Like I think, lifeguarding, there's a lot of room for lifeguarding to evolve and grow. Research, art. I mean, there's all these guys who are writing incredible books about this stuff right now. And so the more that we can do to expand what ocean lifeguarding is, both in the public's mind, but also in our own mind, right? Like my vision here is that every seasonal lifeguard listening to this tower also sees themselves as a researcher, as a data collector, right? In your mind, every lifeguard with an Instagram, account is also a lifeguard photographer, right?
Yeah.
And so as we continue to expand in our own mind of like how we define this culture and this wonderful, beautiful, picture of what lifeguarding is, groups like the Ben Carlson Foundation are able to help us expand our own thinking a little bit about who we are.
Absolutely. And just to say from me to you, I learned so much just from being able to sit down and read this. And I've been a lifeguard for 15 years, and I've been thinking about this of doing it. But when I've taught lifeguarding too, when you put it into a different context, I was learning.
Yeah,
I was sitting there and learning. And I thought that was super cool. And that's why I wanted to have this conversation, for people to have that spark to go, okay, calling all lifeguards here, right? Are you a researcher? Are you a photographer? This or that? Let's bring this stuff together through whatever means, like you said, one big group text to all the leaders of the World Health Organization on drowning, or one website where we can all communicate or share these things, share the stories, share the pictures, share the data, right? That's equally as important in having a photo. Let's put some of those statistics or graphs underneath it. Now we can hit all of those aspects. So that's the vision a little bit with that. Any messages that, as we wrap up, that you want to leave for the public or parents or lifeguards on behalf of what you've learned or your experiences that you want to kind of close out with?
look, I mean, if I had a magic wand and I could make anything happen, it would be that every kid in California or wherever you are learns how to swim, right? Like I'm the coastal guy, I'm the ocean guy, I'm the beach guy. I love lifeguarding, but if someone can't swim, they're not going to survive a rip current. Doesn't matter if they know it's there or not. And like I said earlier, Drasko, for you and me, water has been a really important part of our life, and I would love to see everybody have that opportunity.
Yeah, absolutely. Cool, man. Well, I think we'll close it out with that.
Great. All right, Drasko, thanks so much for all your work.
Thank you so much, Will.
And thanks for reading the big long thing.
Right on, dude.
All right.